Patterns and experience. Experiences shared during the PATC programme were varied, reflecting the diverse nature of the population of Scotland and people's unique circumstances and challenges during this time. However, the following patterns emerged from the experiences that were shared across the programme. Reduced and disrupted access. There has been a lack of access to healthcare services across the board, where the prioritisation of COVID-19 has had an impact on people with non-COVID-19 needs, whose care has been consequently interrupted and delayed and health needs not met. The impact of this lack of access has been considerable and led to a worsening of people's physical and mental health. People reported experiencing a number of disruptions which have impeded their access to healthcare services, such as paused health clinic, appointments cancellations, increased waiting times and difficulties in making appointments. Quote, "They felt like they are inaccessible unless you have COVID. I received messages from GPs advising not to visit the surgery at all, but never received a message saying it was now safe to do so." One. Digital delivery of services. The digital and telephone delivery of services has enabled people to continue to access health services during this time, and for many the options of remote health appointments proved an easy and flexible approach that was welcomed. However, for some people, seeing a health professional face to face was felt to be a priority. This was particularly true for people experiencing mental health issues. There was also a lack of confidence in digital services being able to provide the same level of care and support. It was strongly felt that whilst digital services may be appropriate and effective to use in a variety of circumstances, face-to-face contact was described in various ways as a basic right that should continue to be available. Quote, "I am not confident that health professionals are assessing me properly if they are only speaking to me on the phone." Two. Unhelpful variation in access. People's experience of accessing healthcare services during the pandemic has been mixed and contradictory, varying with geographical location and across services. The experiences shared of accessing general practice services were particularly mixed. Whilst many people have had positive experiences with general practice services and shared that they can't fault services, a larger portion of respondents have not been able to access the care that they need and have shared their difficulties in gaining access to their GP. Quote, "Feel the practice have shut shop since the beginning." 3. People's physical health has deteriorated. Reduced access to services, particularly those which monitor health, provide ongoing support and keep people well, was shared as resulting in negative implications for people's physical and mental well-being. Specifically, people with long-term conditions described concerns about the impact on their longer-term health and well-being, as well as a reduced ability to manage their condition in the short term. A perceived lack of consideration for preventative services and routine care was raised multiple times. This was particularly the case for people who relied on community support groups, respite care and ongoing rehabilitation or prehabilitation support. 4. People feel abandoned and frustrated. There has been a strong emotional response for those who have been unable to access services during the pandemic. There have been significant levels of fear and distress amongst people who have had appointments cancelled or their treatment paused. This frustration has been compounded by confusion and a lack of clarity surrounding the definition of urgent versus non-essential care or support during the pandemic, and relates in particular to the theme below about communication. Quote, "I have given up trying to access services as I found it so disheartening." 5. Delivery of and access to mental health services. Experience of mental health services has been mixed, though of those who responded, negative experiences outweighed the positive. At this time of increased need for mental health support, a prominent theme which has emerged is the reduction in its availability. This inability to access appropriate mental health support, coupled with the wider stresses of the pandemic, has resulted in people reaching crisis point. The majority of participants shared that they found the digital delivery of mental health services to be an inappropriate and ineffective model of delivering support, and many people felt uncomfortable using this type of support. Quote, "I didn't find talking on the telephone to someone I've never met either helpful or comforting."